Hi guys, welcome to another episode of Labor Room on your favorite health website www.checkwithdro.com, and as usual I'm your lovely host Dr. O. Well, let's see, what was our topic for today? Today we're going to be discussing a very interesting topic. As usual, we always discuss interesting topics on Labor Room. I mean, that's why you're always tuned in on Thursdays, isn't it? Okay, I'll tell you about the topic we'll discuss after this short break. Let's just go on a quick break, and then when we get back, we'll discuss the topic for the day. Welcome back, guys. So like I said before we went on a short break, I'm going to be telling you what we'll discuss this week. And this week actually we're going to have a really short podcast, but very interesting, and we're discussing pregnancy symptoms you should never ignore. Of course, there are so many symptoms of pregnancy. Everybody knows the usual: nausea, vomiting, feeling tired, maybe eating more and all that. But there are some symptoms that you should actually look out for, and whenever you experience these symptoms, you must make sure that you don't ignore them, because they could be a sign that something is terribly wrong with the pregnancy. So what are these symptoms? I'm going to be discussing 6 of them today. Okay, so what's the first symptom? The first one is vaginal bleeding or spotting. So what do I mean by this? Any form of vaginal bleeding in pregnancy, it's usually not a good sign, because it can be an indication that probably a miscarriage is going on. It can be an indication that maybe there is a placental abruption. I think we've discussed this in our previous podcast, when the placenta is tearing away from the wall of the womb, and when this happens, it can cause fetal distress, can put the baby in distress, and it can lead to fetal death. That's the death of the baby. So any type of bleeding in pregnancy should not be taken for granted, whether spotting or actual bleeding, painless or with pain. Immediately you notice this, just go straight to the hospital or call your doctor immediately, because it might be a sign that something is wrong. Okay, so the second sign that you must never ignore is abnormal vaginal discharge in pregnancy. Now, how do you know if your discharge is abnormal? I mean, like, discharge in pregnancy is normal, especially when it's increased and all that. But how do I know if it's abnormal? What makes it abnormal? Okay, if, for example, you notice that discharge is becoming more watery, or it's becoming more like mucus, or if you see blood in it, maybe a tinge of blood inside, especially when you are not close to term, that's especially when you are below 37 weeks, it might be a sign that there is preterm labor going on. Maybe the cervical mucus plug that was covering the cervix has fallen out and you are going into preterm labor. So if you notice this for any reason, you need to report it to your doctor, so that appropriate measures can be taken or carried out as soon as possible to prevent any harm to your baby. Because if that happens and your baby is not to term, there will be series of complications that can occur in the pregnancy, and you don't want that to happen. So yeah, abnormal vaginal discharge. Also, another type of abnormal vaginal discharge could be maybe if you're having the usual discharge that you see and is accompanied with lower abdominal pain, so pain in your lower abdomen, or itching in the genital area, or soreness in that area. That might be a sign that you're having a genital tract infection, and it's something that should be treated. So make sure you report any abnormal changes to your doctor. So the next point we're going to discuss is pain or burning on urination. So what do I mean by pain or burning on urination? You go to the toilet to pee and you feel like, okay, every time you want to pass urine is really painful for you, or there's this burning sensation you feel when the urine is coming out. That is not a symptom of pregnancy. That is abnormal. It can be a sign that you have an infection, in a urinary infection, maybe in your bladder or something. And because pregnant women are usually more prone to having these infections, so you have to be more observant. If you notice that, you need to go to the hospital immediately and report it to your doctor. Why? Because the infection can actually get worse if you don't treat it, and it can go up from the bladder into your kidneys, and you don't want to have a kidney infection, because that will even be worse. But we'll discuss this more in later podcasts. For now, let's just focus on abnormal symptoms that you should never ignore in pregnancy. Okay, so I have two more symptoms for you, and this particular one is for women that have probably passed mid-pregnancy and are in the second phase of their pregnancy. Reduced fetal movements. What does that mean? When you feel your baby is moving less and less, so your baby doesn't kick as much as he or she used to, is not moving as much as he used to. It's not that your baby is sleeping or your baby is tired or anything. If you notice that your baby is not moving as much as he usually does, then it can be a sign that the baby is in distress. It can be a sign that something is wrong, and you must report this particular problem to the hospital immediately, because women that ignore this, sometimes it usually ends in stillbirth, so the baby dies in the womb and they don't even know the baby is dead, and then the next time they do a scan they find out that there's no heartbeat and the baby died. And if you had only been observant to notice that the movement had reduced, at least something would have been done to save the baby. So please try and be observant. You can do what we call a fetal kick chart, where you monitor every movement of the baby at particular intervals, but we'll discuss that also in later podcast. That's why you have to stick to labor room, because there's a lot to learn here. The next one I'm going to talk about is pain in pregnancy. Lower back pain, abdominal pain, or if you start to feel contractions, especially when you are not close to term. What do I mean by close to term? You are not 37 weeks or above, so anything below 37 weeks, and you are feeling persistent low back pain, you are feeling persistent lower abdominal pain, and you start to feel contractions, especially if the contractions are more than 4 in an hour, then it can be a sign of preterm labor. That means you are going into labor before time, and this is not good. Sometimes it's possible to have minor contractions, fake contractions that we call Braxton Hicks contractions, where you're just feeling minor contractions, they're not constant, they're not increasing in intensity, and it just comes and goes. That is normal for it to happen. Maybe your uterus is practicing for labor or something. That one can be ignored. But when the contractions become more frequent and increasing intensity, and you are having at least 4 in 1 hour, and you know that it's not yet time for you, it's not close to your due date, then you should actually be worried that you are going into labor, and you should report this to the hospital immediately, so that something can be done to stop the situation, or to control the situation rather. So the final point I'm going to talk about, okay, this one is facial swelling or puffiness. So when suddenly you notice that your face is getting more swollen, is looking more puffy, and maybe people are telling you, yeah, adding weight to chubby cheeks, this one, you need to watch out, because the puffiness might not exactly be you adding weight. It might not be fat, it might not be as a result of eating too much, especially when it's sudden, and especially when your eyes are also puffy as well. It may be a sign of kidney problem, and kidney problem can be very, very serious in pregnancy, so you don't want to overlook this. So if you notice any unusual swelling in your face, puffiness, just make sure that you report it to your doctor immediately, so that whatever problem it is can be taken care of, and you and your baby can be fine. So I mentioned 7 symptoms that you should never ignore. I talked about vaginal bleeding or spotting, talked about abdominal pain or back pain or contractions before time, before 37 weeks. I talked about if you don't feel your baby moving as much as usual, and I also talked about if you're feeling pain or burning on urination, or abnormal vaginal discharge if you experience any, if you notice any. And lastly, I talked about facial swelling or puffiness. So watch out for these 7 symptoms, and if you notice even one of them, make sure you raise a red flag to your doctor, so that it can be checked and everything can be taken care of. So I hope you learned a lot from today, and if you notice any of these symptoms, you would know what to do. Next week we'll be discussing something actually much more interesting than this, and hopefully the podcast will be shorter and more straight to the point. So thanks for listening. Have a lovely day.